Hello, everyone. Today, we're going to take a look into the world of social service in the United States. We're going to explore various programs, key legislations, and the challenges faced by both service providers and those who rely on them. By the end of this presentation, I hope you'll have a clearer understanding of how these services impact lives across our country. So, social services encompass a wide range of programs designed to support people in need. So, these services aim to improve quality of life for individuals who are facing difficulties due to various factors such as age, mental health issues, or addiction. Let's look at some common examples. For example, we have child welfare programs, right? This program or these programs, they look to protect children from abuse and neglect. There's services for older adults, and these services provide assistance to seniors in maintaining their independence. We also have mental health care programs, which helps individuals with psychiatric disorders live fulfilling lives. And treatment for alcohol and drug disorders. These support individuals on the path to recovery. So these programs are vital in helping people from all walks of life, and it ensures that those in need can find the support necessary for a better future. Now, let's look at providers of social services. So, who exactly provides these services? Social services are delivered by a mix of public and private organizations. For example, public agencies such as local or state government departments play a significant role. You have private, not-for-profit organizations like charities that fill in the gap where public agencies may not have the reach or resource. You have for-profit organizations. Also, they offer some social services such as healthcare or rehab centers. Then you have religious organization. They often run food banks, shelters, and other community support services. And finally, mutual help groups like Alcoholics Anonymous provide invaluable peer support. So each of these groups work together to ensure that people in need have a variety of resources available to them. So, one of the primary ways social services are funded is through federal grants. And a key example is the Title 20 Social Service Block Grant. This grant provides funding to states to support a wide range of social services. So, think of it as a critical vehicle for helping states implement programs in child welfare, mental health, and care for the elderly. There are also other federal block grants that contribute, including funding for mental health care, substance use treatment, and more. But these grants are a foundation upon which many programs rely to help those in need. Now, let's talk about social policies regarding families and children in the US. Interestingly, the US does not have a comprehensive social policy specifically for families and children. The general philosophy is that families should be largely free from government intervention. However, state laws do govern important issues such as child abuse and neglect. For example, if there's a case of abuse or neglect, Child Protective Services will step in to investigate and protect the child. But this lack of federal policy means that different states have varying levels of support and approaches for families in need. One of the most important pieces of legislation in child welfare is the Adoption Assistance and Child Welfare Act of 1980, which was later amended in 1997. So, this law has a crucial focus, keeping families together whenever possible, When a child cannot return to their biological family, the goal is to send a child to a permanent home, such as through adoption. This law is pivotal because it emphasizes the key idea of family preservation, but it also reveals a critical issue. Too many children remain in foster care or uh, long periods of without being in a permanent home, without finding a permanent home. So this legislation continues to guide how child welfare agencies work across the country. Now, there are some criticisms. So, despite the goals of family preservation, the child welfare system is not without its problems. One of the major criticism is that the focus has often been on intervention after abuse occurs rather than on prevention. So, this reactive approach has left many children in foster care for longer than necessary. In addition, children from marginalized communities, particularly African American children, are disproportionately represented in the foster care system. So, this raises concerns about systematic inequalities. So, while there has been progress, these challenges continue to demand attention and reform. Now, states are beginning to recognize these issues, and some are taking steps to improve the system. For example, there's a growing focus on family preservation, offering support services instead of jumping straight into investigation and removal. Relatives caring for children and foster care parents are now receiving more assistance, including training and financial support. And additionally, efforts are being made to help foster children transition to independent living once they age out of the system. This could include offering life skill programs, housing support, and education opportunities to ensure that they have the tools they need to thrive. So, shifting gears to services for adults, one of the most critical pieces of legislation is the Older American Act of 1965. This act provides funding for a variety of programs aimed at supporting the elderly. Key provisions including nutrition programs like Meals on Wheels, which help seniors maintain their independence at home, the Administration on Aging in the federal agency that administers this act, guiding states in determining the needs of older adults and encouraging community level services to meet those needs. So, with the aging population growing, these programs have become even more vital in ensuring seniors can age with dignity. Now, issues affecting older adults, right? As the population continues to age, several critical issues arise, such as access to long-term care services, where, seniors often need help with daily activities and access to quality care. This is vital. Affordable housing. Many older adults struggle to find housing that is both affordable and accessible. And then we have protection from abuse. Financial, physical, and emotional abuse are serious concerns that need safeguarding when we're referring to our elderly. So, policies that help families care for elderly relatives and protect older adults from exploitation are also becoming increasingly important as society recognizes that the aging population needs these services. Now, moving to mental health and substance use treatment, a landmark movement in U.S. policy came with the Community Mental Health Act of 1963. So this legislation really just spurred the deinstitutionalization, meaning it encouraged moving patients from large mental health institutions into community-based care. The goal was to make treatment more accessible and less isolating. So, despite these advances, there are still many gaps in services. So, public funding, primarily for Medicaid and federal block grants, support behavioral health programs. However, many people with mental health and substance use disorders still struggle to assess the care, to access the care they need due to a lack of community services and treatment option. Now, the war on drug has been another significant factor in the social service landscape, especially in terms of racial and ethnic disparities. Many people arrested for drug-related offenses have substance use disorders, but often they don't receive the treatment they need while incarcerated. This had led to higher rates of incarceration among ethnic minorities, creating a cycle of disadvantage. One solution to this is drug courts, which allow offenders to participate in treatment programs instead of serving time in jail. And this approach is more focused on rehabilitation than punishment. Now, some social service approaches are controversial, like harm reduction strategies. These include programs like needle exchange, which is more widely accepted in other countries, but has faced resistance here in the US. Similarly, the housing first model provides housing to individuals without requiring them to be clean or sober first. So critics argue that this could enable substance use, while others believe it saves money in the long term and provides a stable foundation for people to address their issues. These approaches are part of an ongoing debate about the best way to help vulnerable populations. To wrap things up, social services in the United States play a crucial role in helping people from all walks of life, whether it's helping children in foster care, supporting seniors aging at home, or providing mental health and addiction services. These programs are vital to the well-being of millions of Americans. As we move forward, it is clear that there needs to be an even greater focus on prevention, accessibility, and community based care.